This morning, more details and more cases of a complication that can affect the heart and blood vessels of children that's been linked to COVID-19. Late Wednesday, the American Heart Association putting out an alert for pediatricians everywhere to be on the lookout for symptoms, as New York State announced they suspect at least 64 cases of what's being called pediatric multisystem inflammatory syndrome. New York now mandating hospitals must immediately report cases to the State Department of Health.
I understand why parents would be anxious. I think everybody should be. This is still a developing situation, and we don't know all the facts.
The symptoms appear to be similar to two known diseases, Kawasaki disease and the more dangerous toxic shock syndrome, ranging from fever and rash to vomiting and diarrhea. Some children, like Jaden Hardawar, who is now recovered, even going into cardiac arrest. The syndrome is rare, but has been seen in Europe and several states in the U.S. The epicenter right now is New York.
We just admitted another 2 last night. I have 6 in my intensive care unit right now who fit this criteria, and these kids can be very ill.
While 2 studies from China and Europe now indicate children might spread the coronavirus, there's still a lot of unknowns. Experts warn kids across the country could be at risk for never-before-seen complications. Dr. Jane Newberger from Boston Children's Hospital says they've never seen anything like it.
Can we tell parents yet which children might be more prone to getting this?
I think we cannot yet give any intelligent information about which children will or will not develop the syndrome.
The timeline for when this inflammatory disease appears can be days to weeks after COVID symptoms, suggesting lingering effects and danger even after recovering from the virus. Kristen Dahlgren, NBC News, New York.